Hello and welcome to Harmoniously podcast. And hello to Rachel.
Good or evening, Mel. Hello, everyone.
Hi, so we have Rachel with us, and this is again, we're celebrating Women Month. And we are going to talk about all subject topics about women. And I'm very interested, of course. But we'll start as always with an arrival practice. So please invite every one of you who can close your eyes, closing your eyes, and just start focusing on your breath. Just allow yourself to be arriving to this moment. Just allow yourself to drop into your own body, your own self, into the present moment. Allowing the breath to support this bridge, this coming into this present moment, into the now. And then slowly come back and open your eyes. All right. So now we are all ready to speak about women. So the last podcast we talked about a little bit about the iron, some deficiency that women may have. The menstrual cycle, very quickly, it was more related about what kind of supplements we can have and so on. So if you're interested in that, please check that podcast. And in this podcast, we're going to talk again about more than, the menstrual cycle, but the menstrual cycle throughout women life, our lifespan. So there are all these different cycles we go through and much more. So let's start.
Yeah. So there's so much to say, right, about all the ladies and like this complicated dance of all these hormones that we have throughout our reproductive years. I think the two big players we typically talk about are like estrogen and progesterone. There are some other dancers on the field for sure. Like we have luteinizing hormone, we have follicle stimulating hormone, we have thyroid hormones. A lot of this is kind of organized or orchestrated by some of the ovaries. The ovaries will control some of this, and sometimes it's also the HPA axis. So our inner brain will help control some of this, the pituitary, etc. So a lot of this is governed by complex things that like we don't have a whole lot of control over. But if I were to say one thing that we had some control over, it would probably be stress. And stress can be a big disruptor for a lot of the hormone systems. So we do my best to be like not being terribly specific, as well as kind of providing some insight. So like, let's just read like what the lifespan for a female looks like throughout with just estrogen and progesterone. We're born as kiddos. For most of our childhood, estrogen or progesterone are pretty much, they're being made, but they're in low levels and they're pretty much stable. And I used to work in women's health, and we had a saying that like, you get symptoms when you have fluctuations of hormones. When they're just nice and even keeled, you're not getting a lot of symptoms. But as we move into our teenage years, what do we start to see is a pretty big kind of fluctuation. So we start to produce more estrogen. We start to see big leaps in our estrogen production. We also start to see progesterone start to do some kind of also productions in waves. This will eventually give us kind of our menstrual cycles, right? Which are kind of formulated around a 28-day cycle for most of us. And we move into our reproductive years, right? Or we might become mothers, we might become career women, we might, be moving through our big bulk of middle life. And we start to see estrogen kind of doing smaller fluctuations and progesterone continuing to do these nice kind of fluctuations.
Okay.
Until we reach about my age, about 40-something, where we start to see perimenopause kicking in. Perimenopause is defined as the 10 years prior to menopause, generally speaking. And we start to see our hormones do some weird stuff again, where progesterone will start to be a little less kind of present, to start to slow down. And we start to see estrogen doing some big spiking. So we see some bigger disparity between these two dancers. And then we have menopause, which is typically it's a full year after our last menstrual cycle. And that's where we see estrogen start to completely drop off, progesterone goes off the map, and basically we've lost any kind of hormonal support. So these women, speaking, may need some hormonal support or other types of things to support them. But that's kind of a big view of like scan what's happening. And there are some very complicated dancers out there too, with thyroid and some other cortisol, etc. But if we were to like break it down into some of the biggest issues we face in each of those time periods, like I think for our adolescence, right? I think as ladies, we all remember going through our teenage years. It was a little bit more emotional, maybe. We start to have our first cycles. They might be a little bit more unpredictable. I think for the most part, yes, it's a challenging time period, but it makes sense because there's a lot of really kind of new players on the scene of hormones really doing what they should be doing. Well, I have two adult children, but they were teenage girls. I remember acne being one of the things that like we talked about all the time.
Yeah.
A really common symptom in adolescence. Some of this is just these newfound hormones not quite having found their baselines, their middle zones. So we do have some more drastic kind of hormone cycling.
And in the case of acne, which one is the most, which of the estrogen or progesterone are higher or more like not doing, let's say, not being balanced?
Well, it's that estrogen's kind of come on scene and is actually a bit higher, but it's not balanced well by progesterone. So it's really the dance of both. Progesterone hasn't quite figured it out yet. Progesterone is often what we think could be one of the culprits for some of the acne. But I think it's so much deeper than that. A lot of this is too, like if you think about what you ate as a teenager, it's not always the most nutritious diet. It might be a little more sugar forward. This can also be some of our hormones are dictating that. So we really think about like the gut brain. So we want to have like reduction in sugars. That definitely helps. That age old like chocolate causes acne isn't necessarily true, but we do see like when our gut gets disrupted and we don't have good probiotics and we don't have good digestion, it definitely impacts. Like toxins are going to come out of your body somewhere. So kind of a really processed diet. We're eating fast and on the run and sugar forward. We're going to see that show up in our skin. It makes sense. And for sure, I think that helps. It's one component. Skincare too, right? We might be playing more sports. We might be, not having a good regime for face washing. So washing faces, things like that. All those basic hygiene can help.
I'm probably also start using makeup that are not like the most quality ones. We go for the cheap ones because we're just having fun with that, and that doesn't help neither.
Well, we often find very quickly that may cause more issues with acne. So never to replace like a good dermatology visit. Big fan from way back, so by all means. But I do think like in general, gut brain is huge. Adding in omega to this group is really important. It supports neurotransmitter formation, which can help kind of the way we feel, but can definitely help the other symptoms we get. So when I think about
omega-3,
omega-3s in general are a really good option for this. We don't typically see a lot of teenagers eating a ton of fish and from food sources. It's a great option. And then things like zinc. I love zinc. I love getting zinc in a food form. So things like green beans, sesame and pumpkin seeds tend to be high as well. We could supplement with some zinc as well. Some decent evidence that it's also immune supportive, but this can be a really important precursor in some of our like hormonal sexual development. So definitely zinc can be beneficial, and I've seen it supplemented in adolescence really well. I had my kiddos on it, and it did help. I think those are some of those things that we start to think about when we think about like acne, but it really is like a dual approach. Like we want to think about what we're putting in and what needs to come out, because toxins will always find a way to come out. Lymph, acne, etc. And some of this is just going to happen as our hormones start to figure out their dance together. So some of this is normal. and to be expected, but it doesn't mean that we have to live through it. There's so many great topicals out there now too. There are lots of great strategies we have at using topical antibiotics, topical suppressors for. And there are some decent oral medications too. So a lot of kiddos that have like severe cystic acne or severe acne vulgaris need to do some more significant treatments. There are some really potent medications out there, but it's not something you have to live with. So it's kind of like a general overview of like how the teenage years look. And then we get to like our reproductive years, right? So our late teens and our early 20s. And
so the reproductive years you count it from like late teens, so you mean like 17, 18 and 20s. That is the age.
Our cycles have started to really kind of regulate. They're a little more predictable for most of us. And keeping in mind, not everybody has a 28-day cycle. Sometimes there are some of us that I've always had 29 or 31-day cycles. That doesn't necessarily mean there's something wrong. In general, in medicine, we always recommend if you have significantly more lengthy cycles, so over 35 days, or significantly shorter cycles where you're having cycles every 21 to 25 days, it's worth investigating. It's worth following up with like a provider. There could be something else going on here. Something deep in the hormones, something else with thyroid. So definitely getting some of those irregularities out. But as we move into this reproductive cycle, now we've got some hormones that are really dancing well. Like they know what they're up to. They're kind of out of a balance. We still got estrogen kind of moving one way and progesterone moving the other. So if we were just for the purposes of education to talk about like a 28-day cycle, day 1 is always the first day of your cycle. So the first day of bleeding. So this is where our period begins. Most cycles will last somewhere between 5 to 10 days. 7 days tends to be pretty average. Some women a little less and some women a little more. And it varies, right? You could have, I always have more stressful months or more heavy months for me. So some other interplays here. And what
I
we
also
see,
notice maybe that's related with the hormones, but like I notice if I am a little bit, let's say, I mean, if my weight is a little higher, I have more PMS, more cramps, more symptoms and everything. And if I am more lean, so I have little bit, I fluctuate very little, so I don't, but still if I'm more on the lean side, I almost have no symptoms and just my period just comes. So is that related to the hormones and how the hormones works?
Definitely. And we think that there's some benefit and some disadvantages to being heavier. Like when we're storing more fat tissue, we actually store estradiol or estrogen in our fat tissue. It actually goes there and hangs out. So women that are moving through like menopause sometimes have an easier time moving through menopause when they have extra weight on, which may be kind of one of the evolutionary type things that could be happening there. So we have more estrogen available. It's released by our fat cells. Unfortunately, for those that are leaner, they might have a little bit more struggle because there isn't as much estrogen available. So you could have some lower estrogen symptoms. So that could be definitely what's going on for you. And we do see girls that fluctuate a little throughout cycling. So progesterone kind of creeps up right before our cycle. And a lot of us will hold on to a little bit more water. It is kind of a water retainer. And then we start to kind of have this diuretic effect once our cycle begins. So the hormones start to level off. So a little release. So there's definitely some hormone interplay there. So the first couple days is our actual bleeding cycles. Then we move into like a proliferative phase. This is all part of that follicular phase. This is just basically moving to ovulation. Your body convinced it will get pregnant every month. So it does the same thing every month to try to procreate. And unfortunately, we're only going to use that a few times in our life cycle to try to, for some of us never, to want to get pregnant or become, with child. Ovulation is really what these hormones are up to the first half of our cycle. We're all preparing to just release this beautifully rich, ripe egg from the ovary, which should happen by some chemical signals around day 12 to 14. So mid-cycle. A lot of women will have interesting symptoms around this time of the month. Some women just feel very beautiful, very very social. Some of this is that evolutionary kind of underlying biology to want to procreate. Other women actually have some pain with ovulation. So we actually call it metal Schmerz pain. It's a pain that can happen as the egg is released. So some women
How do you call it?
Metal Schmerz pain. I think it was named after the physician that
Oh,
determined.
okay.
But yeah,
Yeah.
so you get ovulatory pain, like they'll notice when they're releasing egg, they actually may get some
What
significant
kind
pain.
of pain does it feel?
It's
How does
actually
it?
like cramping pains, and they can feel
Ah,
it. It can be unilateral, so one side more so than the other, as they obviously
ah.
ovulate on both sides for most of us. But it can be a significant pain. Some women that get mid-sticular pain actually are getting this menstrual pain or this kind of
Ah.
ovulatory
That's
pain.
interesting. I think I do have those, but I never heard this before. And I even go check and everything was fine. So yeah, okay, it makes total sense. So I'm
Yeah,
probably not the only one who doesn't know about it and have that. Okay.
yeah, it's not terribly common, but it is enough that I've seen it a million times. So it
Yeah.
does happen,
Okay.
and a lot of girls will get it intermittently. Like they may not get it with every cycle,
Mm-hmm.
some of them. So
Okay.
worth mentioning. And when
Yeah.
we ovulation, we see right before it this big increase in estrogen, which is sometimes I used to think of estrogen as like our pretty hormone. It's like what makes us more kind of social and more symmetrical appearing, and our pheromones change a little bit. But that's on
Mm.
purpose. It's like procreate, make babies. So it's just biology. And then after we ovulate, so say we do have a successful ovulation and we do not have pregnancy occur, all the hormones start to go, okay, well, we didn't make it this time. So now we need to, because what your body has done is grown this beautiful, rich garden in the uterus, right? So prepare for the baby that's going to come every month that it doesn't show up. So what it ultimately has to do is now shed this garden. So now there's a new chemical player and we move into the luteal phase, which is that second half of the cycle. And progesterone will start to creep up. So as progesterone starts to creep up, it hits kind of a peak right before our cycle and then starts to taper off and we start bleeding.
Mm.
So there's a lot of other hormones that are playing here. So we have obviously our luteinizing hormone, we have FSH, we have a couple of other players, but generally speaking, estrogen and progesterone are kind of ones just for the purposes of this that we'll kind of focus on. Progesterone is right before our cycle is increasing. So a lot of girls before their cycle are going to get, if they may be inclined to, more PMS symptoms. This is also where we see symptoms of PMDD or premenstrual dysphoric disorder, which is one of our more unique symptoms that some girls will get, where it's more than PMS, it's like PMS on steroids.
Mm-hmm.
More, it's more rage oriented, it's more irritable, it's a very intense couple of days for these girls that feel, and it's really hormonally driven. It's really that they're
Okay.
really out of sorts.
So how can you differentiate from a regular normal PMS to
Yeah.
more extreme?
Yeah. PMS is generally pretty tolerable. You might be a little bit more irritable or tearful. The PMDD is actually on the DSM-5, so it is part of one of our psychiatric clinician, driven disorders. It does have a set of symptoms that we might look to see, are we differentiating? Girls that have this generally come to tell me they have this because they know they have this, because they've been living this way for a long time. It impacts relationships. Like it absolutely, like their partners are saying, like, we need to do something. This is something that like feels out of control in our body. It's significant, like emotional fluctuation during the time period. And it can be very interrupting for our regular life. Girls may miss work days during this time period. We may have big emotional upsets in relationships. It can be extremely, extremely upsetting to have this type of condition.
Okay.
So the good news is it only lasts a few days each month, but the bad news is it's coming every month for most of us. So one of the things that we see with PMDD, and I'll just kind of speak to it since we're here, PMDD is generally speaking, there's a lot of different like thoughts about how to treat this. So like some folks, we think, oh, it's a little bit of like, there's some progesterone and serotonin interplay. Maybe it's a lack of serotonin. So some folks have supplemented with like 5-HTP, which is a precursor for serotonin. They only do it typically like 5 days prior to their cycle starting. So if you have predictable cycles, this can be beneficial. I've also used SSRIs in this setting. So it's actually interesting. We might use a medicine like Prozac for 5 days out of prior to our cycle. And it's just for those 5 to 10 days. Sometimes we go a few days into the cycle just to really give our brain some extra support, and that can help with symptoms. But what I've actually seen work pretty well is doing more lifestyle modifications too. So I and, adding in more yoga, restorative work. Obviously, if there's a history of trauma, we do see a higher incidence of PMDD with patients who've had trauma. So always getting to the root cause of getting in a therapeutic relationship, working through trauma. But also saffron. I worked with saffron a bit. It's one of the botanicals, and saffron can be supportive here. So it's a nice one to add in. I think it's around 15 milligrams a day for those days. Take it regularly. And I actually have treated several patients with PMDD effectively with ketamine treatment. So we do a super dosing 5 days prior to cycling or around when they start to feel those symptoms creep up. They're usually pretty well aware of their symptoms. And we do singular dosing once a month, and they've actually found that it's completely reduced their symptoms. They feel like they've absolutely gotten back into their normal kind of rhythm. And it's absolutely been a highly effective treatment. Not for everyone, but absolutely one of those things that when you have this and nothing's worked for you, a viable treatment option. And I've seen it work very well in the population and be very low risk. So we're talking about really low dosing with once a month, which is a really nice way to orient the cadence of this. And for the amount of benefit we get from it, by all means. So that's one of those great options.
It's very interesting.
Yeah, we could do acupuncture too to consider, regulating some of those other tracks in body and brain. We could do more restorative type yogas, breath work. It tends to be our go-tos. These can be really stressful times of the month. And this is also just to speak for PMS, for those that are feeling a little more angsty or anxious around their time in their cycles, a little more frustrated, irritable. These types of practices can really help. What types of breath work? I saw your post the other day on bloated breathing, which I love, alternate nostril. So lots of different breath work techniques I don't think a whole lot of people are aware of.
Yeah, for sure. I was just thinking how what you were saying, you're explaining on this. I was just thinking, just one common thing is that we need more sleep before our period. And that if we continue, and that's what came in my mind, if we continue to have try to have the regular schedule, then we're more tired, right? And then we start with more tired, and we try to put in all the activities as always, but we're more tired. So that's by itself definitely gives more stress and irritability. So that's definitely something that it's probably will happen anyway, but it's definitely not supported by trying to do the same thing we do the other part of the month. And so, as you were saying, restorative yoga or yin yoga, which are a little different. So restorative is more, as the word says, restorative. So you stay much longer in each pose, about around 5 minutes. And you use bolster, which are cushions, and other props that support all the relaxation. And the pose, the asana, is supported 100%. While the yin yoga that is being created, I think been around about one century, something like that. So it's pretty new. And it's still more relaxed yoga, and it's still the poses are supported or you stay in the poses for longer than any other, Hatha yoga, Vinyasa for sure, and Ashtanga and so on. But you stay in each pose, still longer. You are helped by gravity to extend, but you're still do a little bit of work. So you're still try to do more stretching and somehow work your muscles in a more gentle way, while restorative is 100% just supported. So I would say you can try both and see which one of them will work best for you, or even a combination of both, because why not? Sometimes it's very useful just to do some yin yoga, because anyway, maybe also I can imagine during that time before our period, you still want to do some deep stretch anyway. Do you want to gently force a little bit? That can be some benefits as well. Because also if yoga itself, moving the body helps to release emotions on top of bringing back and regulate the mind body connection regulate nervous system. So that already helping with that. But you still maybe want to work your muscles more.
Yeah.
Or anyway, you want to just really relax. And that 1 hour of restorative yoga in which you looks like you do nothing.
Yeah.
In that 1 hour, you really feel regenerated and more alert, because it's worth many hours of sleep, I would say. So that can definitely help balance all that. And then for the breath, there are so many breath in yoga, breath work, or like in Sanskrit pranayama. And yes, the alternate breath technique is one that balance both sides of our nervous system. And then there's so many and really go down, like I normally just use the alternate breath technique, or just like some quick breath, or just like a simple close your eyes and focus on your breath, like we do at the beginning of our podcast. And that's really, and there's a couple of more that are very common, but it's really enough to really focus on your breath. Just, I would suggest the easy and basic one would be close your eyes and focus on the inhale and exhale. And if you also focus on making the exhale a little longer than the inhale, that really will help you to calm down and relax.
Yeah. That prolonged exhale can actually tap us into our parasympathetic system more readily. And it certainly happens faster than trying to think your way through it. So one of the sayings I use that I learned from one of my yoga teachers was, you're more likely to calm your body. You're more likely to calm your mind with your body than your body with your mind. You're not going to think your way out of something, but if you use your breath, you use our body, likely to calm, which really speaks to the system we're talking about right now. The time right before our cycling is a little bit more stressful and more hectic for us, just hormonally. So if we also have life stressors going on, right? Like the kids are going crazy, or like work's really stressful, or like mom's sick, or whatever's going on, you can see how adding that into an already kind of chaotic hormonal system can be really detrimental. And also, you mentioned sleep. Like, as our progesterone starts to climb before our cycle, it actually impacts sleep. Like, it's like the silliest system of all. Like, the time you need the most sleep, and it starts to impair. So it's like usually those few days prior to our cycle, women have a little more trouble falling asleep, staying asleep. That's progesterone for you. And I love progesterone, big fan. Like, really, especially if I'm in perimenopause, like, good fan of progesterone. But it can start to, as it creeps up, impair our sleep systems prior to our cycling. So if we're saying, like, who doesn't want to feel supported, right? Especially as a lady out there in her reproductive years and all this chaos going on inside and all this chaos in the world, feeling supported through like restorative yoga or yin yoga, like in any form of support, like I think that's something we all need to call to. Like we often have struggle, especially in Western cultures, of like reaching out for support or asking help, even in the way we do things for ourselves. So this is a really important, I think, kind of filler.
What about going for a sauna?
Oh, I love a sauna. Yeah, absolutely. Saunas are well-reported in literature to decrease stress, increase cellular health, red light therapies. So when we talk about like other things, so like there are infrared and red light saunas that are out there that can be incredible. I would love to have one.
Oh, yes.
A lot of gyms have them, and other health and wellness places. So if you have access to one, saunas can be incredibly helpful. They can help us with sweating out toxins. They can help us releasing some of that. Absolutely. The other types of like restorative exercise, like swimming, can actually be very gentle on our bodies as another form of like movement without it being yoga per se, if that's not what works for you. I think anything that falls in that category of being generally a little bit more soothing. I love hydrotherapy in general. So balneotherapy. Balneotherapy is like mineral salt bathing, which be really incredible at this time period. Using good like mineral salts, or like I use like Himalayan Dead Sea salts or whatever, which are really no other endocrine disruptors in them. Can be really restorative. They also contain naturally occurring magnesium, which is very soothing to our system during this time period. So there are a lot of other things out there other than like, I know we talk a lot about breath work and yoga because like you and I both practice this, but for other women that are like, no, it's not my jam, or I can't move those ways. Like swimming is a great one, hydrotherapies, sauna, and obviously meditation practices. Like I can't speak good enough. The science is just it's incredible supporting meditation practices.
Yeah. But anyway, just move your body. I would say also go for a walk in nature. Sit under a tree. Pet a cat. Pet your dog. And I would say also just dance. Just
Dancing.
dance.
Oh, dancing's good, right? Dancing is such a beautiful way to really access this movement, but also like release. Like there can be a huge like catecholamine release. Also, just like we talked about with yoga, the yoga really does access a lot of stored emotion. We talk about our hips storing a lot of our previous trauma, our anger. So same with dance, like by just moving and getting our joints moving, it lubricates our joints, it lubricates the spaces between our joints. But also can release some of those other types of stuck, stored things, and definitely has a positive impact on mood. So there's actually been a few studies that show that dancing is more effective than selective serotonin reuptake inhibitors at decreasing depression.
Oh, that's cool. Really? Yeah. Okay. Cool. I can see that. Yeah. Absolutely.
Totally. So even if you don't know how to dance, just start dancing. Your body knows what to do. Just let it do whatever it wants to. Let it be wild, let it be kid-like, let it be fun. So moving your body in that way or putting on music to dance to can be really beneficial. So I think those are all really valuable tools like throughout the lifespan for sure. And so we talked a little bit about like the actual menstrual cycle. So that follicular phase is that first half. We have kind of that middle portion of ovulation, and then we have that luteal phase where everything's kind of preparing to shed, that beautiful rich garden we prepare. And this will happen hundreds of times throughout our lifespan, right? So most girls, men are, although our first periods are kind of getting a little earlier in stage, and there's some theories as to why, but it was on average 12 to 14. We're starting to see that be 11, 12s, even 10-year-olds are getting their first kids now. And then we may move through these cycling. So most of us are fertile through average 40 is where it starts to tilt. And some of us are fertile well into our 40s, like early 40s. Most of us are going to start to have less fertility in that, post 40 time period. Eggs that we do have are not as healthy. They've been around for a while. We've been exposed to everything we've ever been exposed to. So we start to see a drop in fertility after age 40. Other ways we can modify the system. So like not holistically saying that. But 40 to 50, that perimenopause.
And also I have a question, like, even though someone has been taking a birth control all their life, this is still happening, right?
Yep.
It's not like the birth control preserve the eggs in some sort.
No, it doesn't. It doesn't preserve our eggs because our eggs are still basically, you're born with all the eggs you're born. So everything you've been through in your lifespan, they're going through. So any kind of chemical exposure, any kind of toxin exposure, any kind of illness, sickness, etc., they're being exposed. And they also have the same types of like cellular degradation. So they're going through like, they've also been here with you just as long, starting to break down in age.
Of course.
And then, as we start to move through, like, I'll kind of wrap up the reproductive years with saying, like, there is another thing that happens to some girls when we have babies, right? We have this huge system of hormones at play to, like, create this life, right? And for all you girls out there that love pregnancy, like, blessings, I hated every minute of it. Hated being pregnant. It just was not the hormones for me. Like, I always felt terrible the whole time, but I did do it twice, and I'm grateful that I did. I liked it much better as babies rather than the pregnancy time period. But there is a really big, huge amount of hormone interplay that's happening. In pregnancy, I'm not going to get into here just because it's too complicated. But we have a baby, and a lot of women, and there is a little bit of a higher incidence here for those that have had depression in the past, may have more depression or postpartum depression following the baby. And unfortunately, we haven't had always really great treatments for postpartum depression. So there is the baby blues, which is actually really common, and a lot of women will get this, which is just the 2 weeks following babies. Huge hormone cycling that's going on as their prolactin increases, making milk, and just a lot of hormone shifting, volume shifting from having babies, losing lots of weight rapidly. that's one time period that we generally as providers don't get terribly worried about. That 2-week time period of just baby blues is kind of common, and it usually goes away within that 2-week time period. But if it sustains and we're actually having more significant depressive symptoms, difficulty bonding with babies, difficulty getting tasks done, difficulty with sleeping, obviously I'm an infant now, we've got something that's definitely going to interrupt our sleep systems. It could be moving more into that postpartum depression phase, which also has a few phases of like, there's even postpartum psychosis where moms can get really, really significantly sick. There can be thoughts of harming self or the baby. These ones are more kind of treated with a higher level of approach, but postpartum depression can be common in women that have had this before or had depression before, and isn't always well treated because a lot of moms don't want to take antidepressants. They might be breastfeeding, they might be, wanting to do this without any kind of extra support. I will say that there is a pretty good body of evidence supporting the hormones that are going on here. So this really isn't something that we think is like just organically happening because you're depressed or like the brain's broken. No, it's really truly some hormones that are causing some issues. Especially lactating mothers, this tends to go on while they are lactating. So it's kind of a double-edged sword because most of these moms really want to do the best for their babies. But the longer we breastfeed, the more it's kind of keeping these hormones where they're at and really contributing to some of the depressive cycles. So things we can do for sure, 100%, they need to see their doctors. They need to talk to someone about moving through this. This can be a really delicate time period and they really need support. They're new moms, we've got babies, we've got infants, we've got family system we need to take care of. I have also treated postpartum moms who are kind of in that moderate to mild symptoms with ketamine. And there is, before everyone gets crazy about my breast milk situation, typically there's been some studies done that have actually shown that this does just fine. Moving through breast milk, we have a 12-hour hold period. So yes, there might be some humping and dumping initially, but I have actually treated women that nothing else has worked well for, including some of our classic antidepressants in this fashion, and they've done incredibly well. So
that's very important.
Yeah, a lot of moms, especially about maybe once a week treatment versus an we're taking daily. I'm not here to say one or the other is better, but I am saying as an individual, like if you choose to pursue this route, this works better for you, maybe some consciousness shifting, maybe some neurotransmitter resetting. Ketamine has worked very effectively in the postpartum category and can help with resetting some of these like neurotransmitters that can help us feel more aligned back to ourselves and kind of pull us from that depressive place. There's a newer medicine also that is done in hospitals. You have to be admitted to the hospital. You have to have this infusion. It's over like a couple of days. It's a very expensive medicine. Insurance don't cover it. We really should be as a society doing much better to help moms that are suffering from this type of thing. It's really one of the most in need time periods we have in our life. So worth mentioning that hopefully there's more treatments coming. And again, like the regular supplementation with things like I do, like foundational supplements like omega-3s can be very beneficial. Vitamin C can actually be very beneficial in some of our hormone support. And there are some other things. So depending on the symptoms, depending on what's going on, there are some botanicals and other supplements that may be very beneficial here. It's just always the question of like, let's say for breast milk. So always consult with your provider. What's going on there? Sure, we're not getting baby anything we don't want to. So we wrapped up kind of some of the like reproductive years.
Yeah, I think we missed one little thing. Like we talked about acne for the teenage part. Yes. Our skin go through something else during the reproductive period.
Yes. So, especially right after pregnancy, if you don't get postpartum depression, you might get melasma. You might get melasma while you're pregnant. You might get melasma anyways. So melasma is also known as the mask of pregnancy because we do see it quite often in pregnancy. It's essentially a dark coloration that comes across. It can be cheeks, it can be sides of cheeks, it can be forehead, it can be basically all over the face. The difference is we always want to differentiate this type of discoloration from like true lupus type testing. So there is some slight differences there because we sometimes think autoimmune. This one is usually a darker or hyperpigmentation. So we get basically hyperpigmentation across the facial landmarks. It's super upsetting for girls. I've had this. I think Mel's shared this. She's experienced some of this. It's so lame. Like, it's just like, we were talking a little before that's like, you have your teenage years, you get like acne and, you know, your skin looks a little funky. And you get into like reproductive years and you get melasma. It's like, when is the good time period? When is the like time period that you have beautiful radiant skin? So again, this is usually something that I think is more dictated by estrogen. So we have melanin in our skin cells, basically, and there are skin types that are more prone to this as well. But basically, it's drawing off some of the pigment in our skin. Sun exposure will worsen this. A little more on how I feel about SPF, but using sun protection of some kind is generally warranted, making sure we don't have too much UV radiation. And you go outside, you've got UV radiation. You're inside, you have UV radiation. So there is some sun aspect to this and radiation aspect to this. A lot of this is really dictated through estrogen. So some girls that are on birth control for a long period, well, we can get this because estrogen we're not eliminating estrogen effectively. So it's building up in our system. We can get this hyperpigmentation response. We can get it being pregnant. We can get it in postpartum. We don't really anywhere throughout the reproductive lifespan. So what do you do about this? Well, the good news is, since I first started dealing with melasma, there are better treatments today. They are more available. I really take kind of a dietary approach. So we do want to make sure we're getting good gut health. That's important. We want to make sure our body can eliminate estrogen. Because if we're just suppressing the melanin in our cells and our body's still building up estrogen, we're never really going to solve the problem. So we want to support our detox pathways. We want to support our liver functioning, making sure that everything else there is normal. We want to support our gut health so that we can move through. We do eliminate portions of estrogen through our GI system. So that system is important to be attentive to. So like, what can you actually do? So there is a oral pill known as tranexamic acid, which we also use for heavy bleeding. It has shown to be very effective at limiting melanin deposits in our skin. So it can reduce current melasma and also prevent some of the new melasma that may come up. There is also some really, really good topical products out there now that didn't exist prior. So we do use, there is a couple of compounded creams that I have used personally. There's a company called Muesli. I have no affiliation with them. I don't get any money from them. I don't know them, but I will say they make some really wonderfully compounded by board-certified dermatologists creams that contain several different types of known substances to reduce melasma, and they have excellent results. They can use tranexamic acid topically, azelaic acid, and then use a hydroquinone type cream, which has some risk factors to it, but generally is well tolerated, and there's different percentages. So like 4% is one of our prescription. They can use up to 10%, which can be very effective at reducing melasma. There are lots of other derm treatments, so like IPLs, and I had chemical peels and all the things, and nothing has worked as well as some of these topical creams that we now have available. Not all of this is safe during pregnancy or lactation, so always consult to make sure that's if you're trying to do this right after having a baby. But if you're in other time periods in your reproductive age, generally these things are safe. We really want to make sure we're taking, again, that dual approach. We want to help our body clear our excess hormones because that's what causes this. We want to avoid new sources of it, so sunlight, good protection. And or sometimes changing birth controls can help if this is like a birth control issue. But also making sure that we have some good treatment options. So tranexamic acid orally, or alternatively, there's some excellent topical creams now that are out there that can be way more effective than we've seen in the past. There used to be like zero treatment for this, and it was super fresh for most girls that got this. It was like, oh, you just have hormones, so just live with it. But it can be very, very like disconcerting to like self-image. When we see ourselves, it can be very, very hyperpigmented. So we can have very large patches of discoloration on our face. And then we're wearing more makeup to cover it up, or we're, whatever. So that can always cause some other skin issues. But I think that's a big one that we see, throughout the reproductive lifespan. And a lot of girls struggle here.
Absolutely. Yeah. Thank you for all these tips.
Yeah.
All right.
And then, I don't know, I have a ton of time to go all the way into perimenopause and menopause, but I'll at least wrap up those categories to say, we get to perimenopause, it's almost like our hormones, I know because I'm here, and it's unfun. Like your hormones are gonna do like way more weird stuff. But we know in general your progesterone is going to start to decline just slowly but surely. And estrogen is going to start to climb a little bit. And we want these two to have good balance. So we do find that girls that are in perimenopause, I think we've done a much better job today at realizing they can have really significant, quality of life disturbing symptoms. We're going to have more weight gain. We're going to have more sleep disruptions. We're going to have less stress tolerance. We might have cortisol. We might have adrenal fatigue on the opposite side, less cortisol. So there are some things that, generally speaking, can be helpful. Most of the things we talked about with breathwork and yoga, supplementing sometimes with other types of things. Like I use vitamin C in this population to help with progesterone and estrogen's balance. Chasteberry tree, which is a bark, I believe, is also really, really important supplement that can be very effective, especially in our low progesterone. I also sometimes use micronized or like bioidentical hormone therapies for these women and actually put you on cyclical progesterone to help just kind of go through this time period. There's a ton of really great options here depending on what our primary symptoms are, like either decreasing our stressors and our cortisol, or helping our body respond to stress, or maybe it's working through the estrogen and progesterone symptom. But my takeaway message here is that girls that are going through perimenopause is super real. Your symptoms are valid. And if your physician is not listening to you, you need to find a physician who will listen to you, because it's a very real thing to go through. And this is a huge portion of our life. Most of us are career women, we're supporting families, we might have teenagers. It's a really important time period to be able to feel your best, and your hormones are fighting against you. It can feel kind of like a betrayal of your body. It's worked for you for so long, you knew what it was doing, and now it's like off the rails. And that's often how I feel. So I do encourage girls to really validate, like, this is a real thing and it's treatable. And there are physicians out there who are treating this. There are providers out there who will listen and absolutely find a program that makes sense. And same with menopause, because as we move into menopause, our body's just stopped producing most of these types of hormones. And I think we've kind of come back around more recently into supporting like bioidentical hormone therapies and hormone therapies in general, being really supportive for girls. But also there are other things, sometimes we also may have more anxiety, more depression, more stress at this part of our life. So managing these stressors can look different as it might have when we were 20 or 15. So it's worth finding these things that have worked for us, and that maybe even new things that might work for us, because these are very significant time periods in female reproductive life, and they need support, and they need knowledgeable providers, and they need people that can help guide the path, because it doesn't have to be miserable. And the studies have reported time and time again, living through some of the perimenopause and menopausal time periods can be some of the most stressful for women. And it's often because there wasn't really anything to do about it. We were like, well, just get through it. So today, I think we've finally taken a little bit more of a different approach to support these.
It's also like a very well, I was doing retreat. Like for many women, it was really not only the hormones, the physical part, but I don't know, I don't want to say the mental part, but like the overall, like saying goodbye to a part of your life, accepting that there's something that is over, that is like, I cannot make baby anymore. Or like maybe some women, I met even women that already have kids. So it was not a fact of not having kids or having kids. It's just like a sort of probably your body itself, and that's what your body communicates to you, is like saying goodbye to something, like we go through this sort of mourning death each time of our cycle. So I can now imagine when you go through the death of like, oh, okay, the whole idea of cycle is over. And not to mention the ones that didn't have kids, and probably now there's no more of that option, and that probably that adds an extra reflection, an extra goodbye, an extra mourning.
It's a huge part of our identity to say goodbye to our fertility, even the possibility of it, because we spend such a large portion of our life in it. So it is a huge part of how girls have lots of, interventions where they've needed hysterectomies and had to say goodbye to this sooner than they'd like to. And it can be a very emotionally charged time period. It is a huge part of our identity. It is a huge part of who we are as women, our purpose, our goal, our function. Even if we've chosen not to have children, it's not necessarily the actual biological legacy, but there is something about this that's very for a lot of us, and it is tied to who we are as women. So I think there is a process that's like, in some other types of traditions, like the mother, maiden, crone, right? Like there's the maiden who comes first, who's not quite in her reproductive years. There's the mother who comes as, it's just basically framing these chapters of our life, in the crone, who is now the wise one, or the matriarch of the families, or the ones that is go to for wisdom and support. So there are important roles throughout all of this, and I think that's part of it, is we have to understand each of these time periods are set up to be full of their own strengths and full of their own wisdoms and learning opportunities. And it's really about us as women, I think, learning to support each other, as our male counterparts learning to support us in our unique kind of journey, and us and theirs. We have different hormone cycles. I think part of that is just coming together, in community and tribe, right? To also be able to support each other, support our friends, our aunts, our sisters, our mothers, our grandmothers, etc., our daughters, as we move through these changes in life, because essentially they happen to all of us, and they happen in different ways, but they happen to all of us throughout our lifespan. And there are so many better ways now that we have to support each other. We have incredible supplements. We have incredible ancient medicines that we use, Chinese medicines, etc., that are available to support so many of the, kind of worrisome or troubling symptoms here. And I think it's just worth at least kind of opening up the topic. So to support the ladies this month, I think it's important to start talking about some of it. I mean, talk about the things that can happen throughout our lifespan, but also some of the ways that we can get support. And we do some of these types of offerings through Harmoniously as well. I mean, we are, for sure, we do ketamine treatment, and it can be useful for some of these things. But also there is some integrative and functional medicine here that can be supportive outside of that type of need. So there are other ways that we can get the support, hopefully through some of the other, coaching, psychotherapy services, as well as like nutritional support, because I think there's no one thing that's going to fix all of us, right? So it's about the right recipe for each of us, which I think you and I talk about a lot.
Yeah, absolutely. Yeah, there is no one magic pill, one magic solution. It's always a systemic approach and individualized to the person, for sure.
Yeah, exactly. And like that study of you and like what works well for you. And I found that even in my 44 years of life, like what used to work doesn't work as well for me now. And like sometimes I have to find new things, access to help me, or something different. So that may change our lifespan.
Yeah, and as you said, like when you were talking about the last phase, that is also the archetypal of the wise woman. I was also thinking, like traditionally in India, for example, they used to have kids and family, around the 20s up to the 40s, and the 40 was the age of the premenopause, and menopause was the time in which, but both men and women would just like, okay, now it's time for spiritual work.
Yes.
And so it's the time to dedicate to the divine, to the yoga, to the union, to the connection, to moving forward in life. Once, let's say, the nature has been taken care, which means like just the reproduction and all that. Even though right now it's a completely different world and we're not doing this, not even in India. But it's nice to remember that each phase has its own beauty and lessons and wisdom. And although I think it's important there is this mourning time also to mourn what has been before welcoming what will come. So, and we have all this phases.
Yeah, those transition periods, right? They're worth kind of taking a moment as we move through each of them. I think it's important for all of us. And then as we arrive at each, knowing that each comes with its own set of opportunities and even rebirths and births of different kinds, right? That it's not like it's like women have this incredible capacity for creating life throughout us. And I think that's play forward even into like our very last breaths, that we have this innate capacity for creating life. So it's this beautiful kind of energy that moves through us throughout our whole lifespan in different forms.
Yeah, that's so beautiful. All right. So thank you, Rachel, so much for walk us through all these beautiful phases that a woman body goes through. Thank you everyone for listening. If you have any comment, any question, any request, just please write everything. And also follow us on podcasts if you want to check out harmoniously.com if you're interested in any of our approach to mental health, well-being, and integrated wellness. Please check us there, and thank you.
Yeah, thank you, everyone. So happy to support the ladies this month, support each other, take good care of each other, and know that we're always here too if you need a little extra support. And thank you, Mel. Cheers to you this month as well.
Yeah, thank you, Rachel. Yeah, cheers.